Now, people living in the rural areas of Jammu and Kashmir will be provided with the same medical facilities that are available in cities. Government is constructing 30 new oxygen plants in these far-flung areas and also providing high-standard medical equipment to these primary health hospitals.
The Jammu and Kashmir government, with the help of the World Bank, has been able to upgrade the medical infrastructure in the Kashmir Valley. The people from rural areas had to come to the city for emergency cases. The inflow to the tertiary hospitals had increased many folds due to the COVID pandemic. And with this grant of $48 million from the World Bank, people from the rural areas will be benefited a lot. They won't have to come down to cities for medical treatments.
The Economic Reconstruction Agency Jammu and Kashmir is implementing a project which is called Jhelum Tawi Flood Recovery Project, which is part of the Prime Minister's development package in J&K. It's a $250 million project. The Government of India and the Government of Jammu and Kashmir with the World Bank allocated $50 million for COVID management in J&K from this project. This funding has created a game-changing influence in the management of COVID-19 in Jammu and Kashmir. We have provided the best world-class medical equipment to the most peripheral of healthcare facilities in J&K, the primary health centers, the secondary, the CHCs and district hospitals, along with tertiary care hospitals across Jammu and Kashmir, in Jammu division as well as in Kashmir division.
There are 30 new oxygen plants being made across the Union Territory of Jammu and Kashmir. 15 will be constructed in Jammu, while the rest in the Kashmir zone. 42 different types of latest critical care medical equipment have been procured and provided to these facilities. In central Kashmir's Budgam district, an oxygen plant is being constructed at Charar-e-Sharif. This will cater to around 150,000 people living in the area.
This is regarding installation of oxygen plants. As you can see, we are providing under World Bank aided project, we are providing oxygen facility to around 30 hospitals across J&K, and out of that 15 are in Kashmir province and 15 are from Jammu province. And right now we are at Charar-e-Sharif Sub-District Hospital. We are going to install around 500 LPM plant, which will provide oxygen facility to 60 beds in this newly created hospital.
The doctors working in the rural areas have appreciated the step and say that it will help them in treating patients in these primary care centers and district hospitals. Earlier, any patient requiring high oxygen supply would be sent to a tertiary hospital in Srinagar or Jammu.
You know that Charar-e-Sharif being a far-flung area, we have to shift the patients who drop their saturation level to the tertiary care. Now that the oxygen generation plant has been established here, and it will give a maximum of 15 liters to the patient. So we don't need to shift patients from this place to the higher center. Only those patients who might need mechanical ventilation, they only need to be shifted. Otherwise, we could now manage the patients here only.
The installation of various vital medical equipment in the primary health district hospitals in the far-flung areas of Jammu and Kashmir will help a lot of people. It will also take away the load of tertiary hospitals, as patients no more will be shifted from these far-flung areas to cities. With video journalist Feroz, Idris Lone for WION World is One.
WION now available in your country. Download the app now. Get all the news on the move.